let me know when you're ready.
Everybody ready?
Yes, you go.
Yep. Thank you.
Okay. Well, it's good to see everybody here today, and the sun's come out just for this particular occasion, which is fantastic. First of all, I'd like to acknowledge that we're on the land of the Wurundjeri country and pay respects to elders past and present, and I'd also pay respects to the Minister for coming here today. This is a good occasion for us. We've got our vaccination van, we're ready to roll. We're going to be doing some work down in Collingwood and also some work out in the western suburbs. We don't have too many Aboriginal health services out there, so we'll be taking the van out there. I would like to thank the state government for all the support they've given us through the pandemic. Anything we've asked for, they've pretty much come to the party, so that's helped us a lot. It has been a race for Aboriginal people to get vaccinated and be taken care of, and the state's been on top of that for us all the time, particularly the Aboriginal Health Unit. So without any further ado, I'd like to welcome Minister Foley. Thank you.
Thanks, Michael, and I too begin by acknowledging that we all gather here on the lands of the traditional owners of this country, and I pay my respects to elders past, present and emerging. And can I particularly thank Michael and all the Victorian Aboriginal community health organisations for the outstanding leadership that they've shown in the whole course of this pandemic. The fact that certainly up until now our Indigenous communities have been amongst the most organised and the most proactive in taking out public health messages has been an outstanding success. But the truth is we need to do more, and we need to make sure that particularly when it comes to communities that have lower vaccination levels, that as we race towards a safer Victoria, that those communities such as our First Peoples communities are supported every step of the way. And that's why today is such an important opportunity to say a few things in that regard. But I'll just run through a few of the numbers of the day first before I get back to that. So as of today, 91.4% of Victorians aged 16 and over have had their first dose of COVID-19 vaccinations, and 74.7% have had their full second doses. Yesterday across our state hubs there were 27,859 vaccines distributed in those locations. There are currently more than 126,000 first and second dose bookings available in our state hubs over the coming week. So if you've yet to get either your first or second dose, please step forward. And that's before there's many other opportunities, including 65,948 second Pfizer dose appointments waiting there if you're due for your second Pfizer. It's really never been easier to get an access to vaccines, particularly as we close in on 80% later this week. And currently, the most important thing we can do is to step forward and support our frontline healthcare workers, our community-controlled organisations like this, and get vaccinated. That continues to be the message, and it's a message that we need lots of different ways to get community engagement through. And that's to make sure that we avoid completely avoidable hospitalisations through COVID-19 by getting as many people with those double jabs in their arms. And currently there are actually 802 people in our Victorian healthcare system with COVID-19 in our hospitals. Some 152 of those are in intensive care and 92 are currently on a ventilator. Very sadly, 7 people lost their lives yesterday in the reporting period to COVID-19. A woman in her 20s, a man in his 40s, a man in his 60s, 2 women and a man in their 80s, and a man in his 90s. We particularly just take this opportunity to reflect and send our deepest condolences to all those families, communities and friends of those people who have tragically passed away. There were also some 56,905 tests done yesterday. Jerome will talk a bit more about testing, but we want to make sure that, particularly as higher levels of vaccination start to play out in the community and we move around more, it's just as important as ever to come forward and get tested. And we want to make sure that those testing numbers stay as high as they possibly can. There were also, in terms of the total case numbers, 1,461 confirmed cases of coronavirus locally acquired yesterday, bringing to a total 24,831 active cases of COVID-19 in our community. And it's important, therefore, that opportunities like this, where Victorian community-controlled health organisations such as the Victorian Aboriginal Health Service are out there leading the community engagement efforts in those communities that continue to be underrepresented in those vaccination statistics. And we really do need to redouble all of our efforts of support for organisations like the Health Service here to do those extra yards of engagement, those extra steps of dealing with community on their terms in culturally safe settings that welcome and deal with the kind of issues that are important to these groups of our under-vaccinated communities that are able to be welcomed in, supported, and to get those numbers up and keep those communities safe. And that is really why the kind of measures that we're seeing here with this van, the mobile outreach, the local community pop-ups, the support we're bringing to surge workforces to make sure that our fantastic Aboriginal community health organisations who have been at this for 21 months straight and are severely fatigued in their efforts are backed up and supported by other services, but led in a safe way, in a culturally appropriate way by those community health organisations to lead that level of engagement and drive those numbers up. And when they do that, to also bring together the material aid that might be needed to support people if there are outbreaks of COVID, that they get the testing rates up, that they get the support for other services in a holistic way, which we've seen as the hallmark of the Victorian Aboriginal community-controlled health organisations' approach throughout this pandemic. And those community approaches have really been the critical path to engagement, and vans like this behind us are further evidence of the government's support for that. There's still more to be done in lower vaccination communities, and these efforts that we're backing the community-controlled organisations to deliver are an important reflection of what the steps that we have to take to drive to 80% double dose, to drive to 90 and beyond. Close to 80% of Aboriginal and Torres Strait Islanders Victorians aged over 12 have had one vaccine. That's clearly below where the wider community average is, at over 90%. When it comes to second doses, 58% of the eligible Aboriginal and Torres Strait Islanders community in Victoria are fully vaccinated, compared to that 71% figure I referred to earlier. And whilst these figures are above the national Torres Strait and Aboriginal community vaccination rates, they're still not what they should be. And what we're determined to do is to work in a culturally safe, community-led partnership with the likes of the Victorian Aboriginal Health Service to make sure that we drive those figures up, and that we do so in a way that reflects the needs and the aspirations of our Indigenous community. Following successful programs that we've run out in partnership with community in Mildura and seen other efforts, particularly in our regions, as Michael's indicated, this effort is now also being expanded in the city. It will also be expanded in coming days and weeks in Seymour, in Warrnambool, around the Mornington Peninsula and the Grampians region. There's efforts already later this week being led in the Latrobe Valley for similar community outreach efforts. Making sure that we've got the pop-up facilities, the staff, the leadership from Indigenous communities that are relevant to localised, bespoke Indigenous communities' needs is really how we work with the likes of the Victorian Aboriginal Health Service and the wider ACCHO network to make sure that our Indigenous community are not left behind, and that we use the strength of this community to bring those numbers forward and to increase the rates of vaccinations and keep our Indigenous community safe, and use that as an opportunity to reflect on what further measures we need to do to deal with the health disparities that continue to plague our Indigenous communities, not just in Victoria but right around the country. I might get Jerome to add to some other more detail, and then I think Michael, Jerome and myself are happy to take questions.
Thank you, Minister, and good morning. And can I start by just acknowledging the fantastic work of the Victorian Aboriginal Health Service and community-controlled health organisations across our state for the fantastic work they're doing to ensure that so many communities across the state are fully protected from COVID. We've reached now 5,189,000 Victorians who've been vaccinated, first dose at least, across our state. That's almost 91% of the entire eligible population aged 12 and over. It also means there's probably about around 500,000 Victorians who are aged over 12 who are not currently protected by any form of vaccine. And it's that 500,000 cohort that we really want to focus on now, because they are the ones who are far more likely to be caught up in our daily case numbers, and we're continue to see very high daily case numbers, and disproportionately likely to end up in hospital or in intensive care. Over the last week, through our GPs, community pharmacy and our state clinics, we vaccinated 140,000 Victorians with their very first dose. So a week ago we would have been around 650,000 people not protected. Today that number's around 500,000. And really now I urge those remaining 500,000 Victorians to come forward for your first dose. Go to your GP, come to your community pharmacy, come to any range of pop-up clinics around the state to get that first dose. And if you have any concerns, please speak to a trusted medical professional who can give you advice about what's right for you. Because what we've seen now of the new cases in the last week, 2/3 of the new cases every single day are not vaccinated. Not a first dose, not fully vaccinated, they're just not vaccinated. We're continue to see a very young age profile. 2/3 of our cases today are under the age of 40. And if I look at some of our local government areas of concern, in Wyndham, 96% of those new cases under the age of 40 were not fully vaccinated. In Hume, 97% of new cases under the age of 40 were not fully vaccinated. So please do it for your own protection and for the protection of those you love around you. Get that vaccination job done over the coming days. I'm delighted, therefore, as part of the ongoing rollout of giving vaccination closer to people, we have 7 more community pop-ups coming in this week, again to really start to target those individual communities where we're still seeing lower levels of take-up. That includes at the Coldstream Community Centre, at the Birchfield Children and Family Centre in Wantirna South, at the Macedonian Cultural Centre in Epping, at the Calcallo Community Centre, at Collingwood Town Hall, the hub at the Northland Shopping Centre, and at Sunshine Mosque. There are literally now thousands of places where you can come and get your first dose vaccination done. And again, if you need any support at all, please speak to those around you, speak to your community leaders, speak to your medical professional, or ultimately call us on the coronavirus hotline so we can ensure that you become part of our vaccination movement. We've seen a fantastic take-up of our mini-pops over the last few days. We ran 9 of them over the last week or so. 270 doses done of those 9 mini-pops. We're not looking for hundreds of doses at those individual really localised pop-ups. We're looking to get to the final handful of people who are still keen to get their vaccine but who haven't found their way to doing it yet. and a quarter of those are first doses. Such important people to get onto our vaccination pathway. We've got another 10 mini-pops running over the coming week at cafes, at headspace centres and community centres across the course of the next 7 days. And our case numbers are a little bit lower today, which is always welcome to see, and again, but we've also seen slightly lower testing numbers. So across metropolitan Melbourne, over the last weekend, we saw around 94,000 tests completed, compared to about 110,000 a week before. So around a 15% drop in testing volumes. Too early to get concerned, but I am, now we're starting to embrace our new freedoms. Now the weather, finally, is getting better. I would urge people still, if you're getting symptoms, please come forward and get tested immediately. Regardless of whether you've had the vaccine or not, we still want to ensure that those people who are catching the virus are isolating properly, are supported to isolate properly, so we can minimise your onward spread onto other more vulnerable members of the community. But please, of course, enjoy the sunshine, enjoy the time out. There are over 200 testing centres still. Turnaround times are good. 90% of test results come back the next day. Please make sure testing, I'm afraid, is part of your normal routine in the event you do pick up any kind of symptoms. In terms of geography, again, the southeast of Metro Melbourne is our greatest area of concern. Only 2 local government areas where we saw triple figure of cases, both of those in the southeast at Casey and Greater Dandenong. But delighted to see that the reduction in case numbers, particularly in the north, is continuing, with Hume recording only double figures this today, or the last 24 hours. That's been 6 weeks since it's taken it to drop back down to double figures, and my congratulations and thanks to everybody across Hume for their sterling efforts over a very long 6-week period. There are still an increasing number of cases in regional Victoria, 252 in the last 24 hours, although a few movements there. I'm pleased to see a slight reduction in case numbers in Latrobe, down to 26, but we are continuing to be concerned around Wodonga, and a lot of work being done with our colleagues in New South Wales Health to support that growing outbreak there. 36 new cases in Wodonga, we believe, more cases also on the Albury side of the border. Daily work now with our colleagues in New South Wales Health. A lot of focus on vaccinating in those across both sides of the border in that community, and my thanks to the local teams there for all the amazing work they're doing to drive that forward. Finally, despite the high ongoing case numbers and 24,000 cases of active cases of coronavirus in the community, it's good to see that our all-important contact tracing systems continuing to hold up and continue to ensure that people isolate safely. Over 99% of people who are testing positive are contacted and isolated immediately within 24 hours of that test result being notified. And again, similarly, primary close contact, over 75,000 of those are all being contacted within 48 hours of the first case being identified and tested. With that, I'll hand back to the Minister for any questions for the three of us. Thank you.
We'll get Michael to go first.
Oh, Michael will come first. Michael.
Thanks, Jerome. Okay.
Michael, can you explain how this works? I know you marked Collingwood in the western suburbs, but
Yep.
does this van go to people's homes? Does it go to parks? Does it go to Indigenous facilities? Where does it go?
All of the above. Whatever it takes, wherever it needs to go, it'll go there. We know that there's a few people down in Collingwood that they've been a little bit worried about whether they should have the vaccine or not. So we're going down there. We're going to, I believe, have a barbecue type setup. So there'll be some food, a bit of a gathering, and we'll do the vaccines. It also, we've got places like Darebin is the largest Aboriginal populated area here in Melbourne. So we'll be talking with them. We'll look at Wyndham, we'll look at Melton, we'll look at all the areas in which we need to go to. It will go to homes. There are some elders who don't want to leave their homes, they're a bit scared. There's also some people with disabilities that are struggling to get out, so we'll go to wherever we need to go. So,
Why do you think the vaccine rollout has been slower in the Indigenous population?
look, I think there's a bit of fear. I mean, you've got to look at the history of this country and the amount of viruses that have come into this country that have been introduced, and the effects that that's had on Aboriginal people, many deaths and everything like that. So there's always going to be fear of any vaccine, any virus that comes into this country. I think in saying that, we've done reasonably well. We've actually done better than I thought, and I think that's due to the fact that we've got organisations, Aboriginal community controlled health organisations, where they're trusted, they're culturally safe. I think that makes a difference. I mean, for us, we've done 7,100 vaccinations since basically since we got vaccines, which is quite high. And that goes back to the foundations of this place. This place was developed by a collective of Aboriginal people who said we need our own health space because we weren't able to get into mainstream health spaces. So they developed this place, they created it. It's nearly 50 years old, and the community controlled aspect means they own this place. They come in and they tell me, Mick, you need to change this and this needs to change and this is the latest issue, and so it's directed by Aboriginal people. So it's culturally safe, it's an ownership thing, and I think we've done quite well. We've still got a long way to go. It's interesting, Jerome was talking about the under 40s, that's probably our biggest gap as well. But we're working on that, and hence why we put younger faces on our van to say, these fellas have been vaccinated, so it's okay, you can come in. But when we're not pushing it, we're just saying, here's all the information, talk to one of our medical experts or your trusted medical expert, and when you're ready, we're ready.
There's been over 300 cases, active cases now in the Latrobe Valley region, many Indigenous families there. What's being done to help tackle that, and is anything done to help the homeless members in the community for self-isolation or help with COVID?
Yep, so at the moment there is another one of these vans heading down that way. It looks a little bit different. This is designed for our local mob, but there is another van heading down there, and that's been coordinated through VATCHO, which is our Aboriginal Community Control Peak body. They had just finished sending up some vans up to the Mallee district because of the outbreaks up there. Latrobe was next, and look, I think they're also going to be looking at around the Hume area and wherever's needed. So these types of things will be set up. The Aboriginal health services down there are doing pretty much the same as what we're doing, and hopefully that'll make a difference.
And are they doing work for the homeless there that need?
Yeah, like us, we work with everybody. It doesn't matter, if you're a CEO of an organisation or if you're living at rough on the streets or couch surfing, it doesn't matter. We'll look after everybody that we can.
Given that gap between the Indigenous vaccination rates and the state average, when we open up more on Friday, are you at all concerned about those who are the greater proportion who are unvaccinated within the Indigenous community?
Yeah, absolutely. That's our fear. I've looked at our data, and our data says that our number one chronic illness is a respiratory problem. But then followed up by that, the next two is depression and anxiety. So imagine being locked up in your house for so long, and whether you've got a respiratory problem or you're suffering some mental health issues, I mean, you're sort of damned if you do, damned if you don't kind of thing. So that's why we're racing to get these vaccinations done as quick as possible, and we're really grateful that we can have these pop-up vans that we can go out and try and speed things up a little bit, try and get to the people who are on that borderline of not sure whether to, or they're struggling to get to a vaccination clinic.
What do you think gets those hesitant people over the line? Is it having a bit more information at the disposal? What's the turning point, do you find?
I think that I've got 10 kids, so they're all different age groups, and so I listen to them and their friends and stuff, and I think for some of them it's just been waiting to see what issues might come out of being vaccinated. Some of them are waiting because they're thinking, well, we need to get the vulnerable ones in first, and they feel quite fit and healthy themselves. So it's just been a bit of waiting mostly. I'm starting to see more come in, which is great, and so I'm hoping that momentum keeps going. We've got through most of our elders. There's still a few that we've got to work on. But the young ones, I do see a bit of momentum on them starting to get more vaccinations.
Which age group do you think is the most hesitant?
Sorry?
Which age group do you believe is the most hesitant?
I would say anywhere between 20 and 35.
It sounds like you know exactly who is or isn't vaccinated as part of your health service. Is that going to be a very targeted approach with this?
It will be. I mean, and it's not just about this, it's about the stuff we do with social media. So we sit on most of the platforms, we push out the message about, the importance of vaccination and how that helps the whole community, because we generally talk about the whole community and how we can protect everybody. But that goes through, Facebook to TikTok and Instagram and every social media. We're trying to reach them as best we can. We also we have what we call the Koori grapevine, which is a lot quicker than me talking to you on the camera, I can tell you. And so that message gets out pretty quick, and it's a good, strong message. You know, it comes from elders, it comes from peers, it comes from everybody.
You've emphasised that you're providing a culturally safe service. Can you explain a bit more what that actually means?
Yeah, I think probably the best way to describe it, as I said before, it's part of the strategic direction for a health service is designed by the community, and not only is it designed by them, but they get to, you know, they come in and as I said, they tell me, Mick, you know, I remember quite a few years ago when we had the AIDS stuff going on, and we was able to get on top of that pretty quick because of the information coming from our community. It's that engagement, that trust in this organisation, knowing that not only are they having a voice, but their elders had a voice in setting it up and putting it together. So it is a home away from home. It's sometimes it's the place where I've often said that once you walk in the door, your healing starts, because you see the people you know, you see the pictures on the wall, you know the history of the organisation, you know why it's here, and you know that it's there for you, your whole family, your whole community.
And it's the importance of the Aboriginal health workers too, that, you know, you don't have to come here if you're sick, you come here just to have a cuppa and connect. And they're your foot in the door to get the message out to the community.
The state's expected to hit 80% on Friday. How quickly are you hoping to reach that?
Hoping we can reach it at the same time. Realistically, I think we might be a few weeks behind, which is always a bit scary. Some areas across the state are doing a bit better than others, which is good. But here in Melbourne, we've got half the Aboriginal population living here in Melbourne, and most of our mob, you know, they trust an Aboriginal health service, but there's really only 2 Aboriginal community-controlled health services in Melbourne, and so we have to do a lot more work. I would say that for our data alone, of our regular clients, we're about 58%, which is in line with the rest of the state. So there's a lot more for us to reach out to, and look, we want it done as of next week, but realistically it's going to take a bit longer, and my staff are tired. It doesn't stop them. They get up, they keep moving, they know the responsibility that they've got, and they won't give up. In fact, the importance of Aboriginal health workers is what this organisation is built on. And I had an Aboriginal health worker say to me, he took a day off and he felt guilty for taking a day off. So their commitment to their people is huge, and they just won't give up. But yeah, they're tired. We need a big holiday at the end of all this.
Thank you.
Thanks, Michael. Very powerful message, and the Victorian Government is going to continue to work with all of our community-controlled health organisations to drive those rates up and learn the lessons of this pandemic when it comes to Aboriginal health and wellbeing.
Can I ask about schools? They're going to ramp up in terms of their opening. A lot of the air purifiers still aren't here, and even the ones that we are going to get, they're going to be targeted for high-risk settings. Why aren't we just putting one in every room? Is it okay to just have the windows and doors open in certain settings versus others? What's the reasoning behind that? And when do you expect to get all these 50,000 in?
So the Education Department are leading that process, and have pretty much prioritised those high-risk communities that in the north and the west. That's not the only measures they've put in place. The whole 3 Vs program that includes carbon monitoring efforts in particular classrooms, the social distancing, the taking of as many lessons as possible outside, and we're determined to make sure that the really important tasks of getting and keeping our schools open for the well-being of our students is one of the major priorities the government has. In regards to the air scrubbers, my understanding is they're progressively coming in. I don't have the specific dates. I'm sure we can get those to you as to what those numbers are. But Victoria has the greatest number of those both on the ground now and scheduled to come in over the course of the rest of the school year. And I think this will be one of the ongoing features of how we make our schools safe, to give parents and communities the confidence that kids can come back, that their well-being is at the forefront of our efforts, and we'll keep them safe and our communities safe.
Minister, given the very clear message the government's sending about vaccination by requiring that unvaccinated people won't have the same access to things as vaccinated people next year, can the government rule out allowing unvaccinated tennis players into Victoria for the Australian Open?
So Minister Pakula has addressed some of these issues already this morning. The Victorian government doesn't issue visas. That's a matter for the Commonwealth. The advice that I've got, that Minister Pakula has shared earlier today, is that we're working through those issues with Tennis Australia and the Commonwealth. My understanding is something like over 80% of the international circuit players are already vaccinated. The Commonwealth need to make it clear in partnership with us and Tennis Australia as to what those requirements are. We're working through those, and I am confident that we will have the world's best field here in the world's best tennis tournament early next year.
Assuming they're allowed in.
We'll keep Rachel.
It'd be a bit of a double standard, wouldn't it, if a famous tennis player was allowed in unvaccinated when, Victorians can't go to the pub if they refuse to be vaccinated?
Well, who gets into Australia is a matter for the Commonwealth, and as I understand the conversations between the Australian Open, Commonwealth and the Victorian Government, the same rules will apply to everyone if you are fully vaccinated, and if you're coming into Australia and you're not vaccinated, as Minister Pakula indicated today, you will be subject to a different regime. So that principle of this is a community that's going to be open to people who are fully vaccinated. So we're going to have a bumper crowd at the Australian Open who are fully vaccinated. The workforce there is going to be fully vaccinated. And we need to make sure that our friends at the Commonwealth do their bit to make sure that the rules apply as consistently as possible to everyone.
So, Minister, by that logic,
We'll go this way.
by that logic, if unvaccinated Victorians aren't allowed to attend major events, even if the Commonwealth lets these players in, does Victoria have the ability to then refuse them in terms of them being able to play in the Australian Open?
So we remain confident that the discussions between the Australian Open, the Commonwealth and the Victorian officials will resolve this in a way that continues to safely and consistently apply all of the rules that all Victorians will face. We don't control the borders, we don't issue the visas, the Commonwealth does that. We'll work in partnership with them and the Australian Open to make sure that we have a cracker of the Australian Open in 2022.
You control the vaccine mandate though and the enforcement of that, and at the moment it's all professional athletes need to be fully vaccinated to play. So would that be enforced at the Australian Open?
We're confident that the discussions that Australian Open are having with the Commonwealth and our health officials will see all of those players who are fully vaccinated come through, and that if there's an arrangement in place, let's wait and see, we'll deal with that to make sure that the same rules apply consistently, whether you're an international tennis player or a punter who wants to go and see the world's best tennis right here in Melbourne.
So Victoria's Premier was very firm on this when we asked him about it a week ago.
Yep.
I asked him whether any special deals would be made for these unvaccinated tennis players. He said it wouldn't. So what's changed in that
I don't think anything's changed. The Commonwealth have made it pretty clear from every conversation that I've been involved with and every public statement that I've seen that they'll only be allowing people who are double vaccinated in. The Federal Minister for Immigration made that really clear a week or two ago.
Only about a third of the men's tour, about 40% of the women's tour are vaccinated. Does that surprise you?
I can't speak for international tennis players. I did read a piece which struck me as maybe an explanation in recent times that said they're always on the go, and this is the time of the year in which they kind of ease down between now and Christmas, head back to home base, and that their professional associations were all strongly recommending that they get vaccinated, and that they were likely to do so between now and Christmas. I look forward to record vaccination levels amongst Victorians. I look forward to record vaccination levels amongst anyone who comes to Australia.
If the Commonwealth does come to an agreement with Tennis Australia to allow unvaccinated players into the country, will the Victorian government provide an exemption from the vaccinated ban for worker list, which requires all athletes to be vaccinated?
So, as Mr. Pakula indicated, who comes into Australia is a matter for the Commonwealth. We'll work through the evidence if and when those circumstances arise, but the Commonwealth Migration Minister made it pretty clear that those circumstances weren't going to happen.
But it's possible they'd be able to get an exemption, given that that's the rule in Victoria. If they're able to come in, they've got to play.
So let's deal with what's going to happen when it happens. I'm confident that the conversations that the federal government are leading are going to resolve these issues.
Moving to, sorry.
So you don't think you'll have to provide any, there'll be a question of providing an exemption?
Oh, well, let's wait and see what the Commonwealth do or don't do, and what Tennis Australia and the professional tours all land with. I'm confident that the world's best Open, the Australian Open, will go ahead safely. It will go ahead with a fully vaccinated crowd, and I'm pretty sure it will go ahead with a safe and vaccinated player group.
Do you see how that's a double standard if only vaccinated people are able to attend?
No. Who's saying otherwise? The same rules that apply whether you're an AFL player, going to an AFL game. My understanding is the visiting English cricket team are going to be fully vaccinated together with their touring squad. I look forward to a bumper Boxing Day test crowd. I look forward to the Australian Open following the same rules, safe and open.
Moving to retail now, just a couple of questions on that. From this Friday when things reopen, will shoppers in non-essential retail need to be vaccinated? And secondly, retail workers had a reprieve, but then from November 24th, all need to be vaccinated. So in that time between, what are the rules?
So I saw some of the, I think, reporting around unvaccinated people seeking access to non-essential retail as of this Friday. Of course we want everyone to be vaccinated. Come forward and get vaccinated. It's how you participate in the wider community. But when it comes to those arrangements, we won't be excluding that workforce until such time as we've given them reasonable opportunity, and the kind of dates, Health are working through those now, but the kind of dates that you're talking about are what Health are looking at.
Is that an acknowledgement that perhaps you could have given the hospitality industry a little bit more notice?
Not at all. Hospitality have come forward in really strong numbers, their workforce. We've seen them as part of the workforce that has come forward in the 70% figures in really strong numbers. It's a recognition that the way you participate in our economy and in our society is to get vaccinated.
So just to clarify, the workers in that time between this Friday and the 24th of November, they don't need to be double vaccinated to work?
Well, they've got to get vaccinated and Health will work with the sector, will engage, whether it's the 24th or whether it's before. It'll be a granular assessment of the detail of the dates, but if and around then, if you haven't been vaccinated or you've had your first jab with Moderna, there's a 4-week figure there. If it's Pfizer, there's a 3-week figure. So it's a nuanced solution based on actual data that applies to that sector. And Health are working through those issues.
Why the difference in rules between hospitality and retail? What sets them apart?
Well, that's what the roadmap to reopening said, that in terms of where non-essential retail fitted as opposed to essential retail, as opposed to getting people back out and engaged in the active vaccinated economy, that's what the roadmap said. Safe but steady reopening that made it the kind of targets that we've smashed at both 70 and I hope 80% in record time.
In terms of vaccination rules, why the difference in vaccination rules for retail and hospitality?
Well, we want everyone to get vaccinated, and that's how you participate. But the truth is, whether it's health services, whether it's essential food or non-essential retail, they're different arrangements apply because everyone's got to have access to health. Everyone's got to have access to food supplies. Everyone's got to have access to critical services. But if you want to have access to non-critical, non-essential retail, and there are other alternatives for you to get access to those services, it's perfectly reasonable under the Chief Health Officer's orders to make sure that there are alternative arrangements in place. So this makes, in my view, and more importantly in the public health order's views, eminent sense to act as an encouragement for people to come forward and get vaccinated.
So just confirming, they don't need to even have an appointment to be vaccinated to be able to reopen stores this weekend?
But by the time that health sets, which will be at around that 24th of November, hopefully before, everyone who wants to work in that sector needs to come forward and be vaccinated, and they will be under the same obligations as the rest of the vaccinated economy when it comes to ensuring access to those sites is for vaccinated people.
So you don't need to be fully vaccinated this Friday, but do you need to have had your first shot?
Well, I believe so, but it will vary depending on the circumstances at hand. But we're confident that the arrangements in place will ensure access to services and, more importantly, drive those vaccination rates to 80 to 90 and beyond.
And when will you announce the date of that?
Very soon. We're just working through those with industry groups and others, but it'll be at or around the date that you've noted.
And what about regards to community sport, whether volunteers and people attending need to be vaccinated?
I'll get back to you on that. But when we're driving to 80 and 90% vaccination levels, we're pretty confident that that will be reflected across the board. But rather than wing it, why don't I get back to it?
The rules are set to relax at 6 p.m. on Friday. There are a lot of people planning trips to regional Victoria.
Yes.
Was any thought given to perhaps making it an earlier period of time so you're not kind of condensing the proportions of people on the roads and traffic out of Melbourne?
Well, the arrangements are in place historically throughout the course of this pandemic. The rules have changed at 11:59 p.m. For all sorts of reasons. We're confident that we'll hit that figure this Friday, and it's an informal long weekend. It's the second weekend in which restrictions have been lifted. 6 p.m. was a sensible solution that balanced the need to make sure we got to that guideline, that figure, whilst allowing whether it's the visitor economy, the hospitality venues, and people to start making plans. 6 p.m. is a good compromise.
I guess the argument is if you'd made it midday, some people who could finish work early could leave early, and then you're kind of spreading people out on the roads. Did you give any thought to that?
Look, we give thought to all those kind of things. The operational meeting that we conduct every morning across all government agencies had input into that. We think this is a sensible, safe and measured set of arrangements that give Victorians plenty of notice, allow us to make all the plans we need, whether it's for a trip to the country, whether it's for the city to the country, whether it's the country to the city, lots of events and lots of hospitality and other venues being able to safely open.
Given testing is going to be important even when we get past 90%, will COVID testing remain free for Victorians for the foreseeable future?
I certainly hope so. As far as the Victorian government's concerned, it certainly will be. In terms of what happens in the Commonwealth jurisdiction, you have to ask them.
But the government keep that free in its centres?
Absolutely. Vaccinations, we want to make it as easy and as accessible as possible to make sure that people have access to both vaccinations, and shortly it will be boosters, and testing. They are the two critical things that need to be sustained well into 2022.
There's been some graffiti in the inner west on businesses and sporting pavilions, anti-vaccine kind of stuff. What's your message to the people behind that graffiti?
Oh look, graffiti doesn't beat the virus. Vaccinations beat the virus, and save your effort. Go and get vaccinated.
Has there been modelling done on the impact of continued vaccine mandates through 2022? And if so, what does that say?
In terms of making sure that, particularly as we move into booster shots, we're awaiting what the rules from the Commonwealth will be. We're expecting that as soon as today, potentially, and we stand ready to assist. What that then means for how we then go about delivering those booster shots, what that then means for keeping on top of the outbreaks. There's lots of work going on internationally, and we'll work with all of our researchers, all of our public health teams, their global networks, to figure out what that means for getting on top of and staying on top of this outbreak in 2022.
Did the woman in her 20s die with comorbidities? She might be one of the youngest we've had pass away.
Look, you'll understand why I don't want to go into the particular circumstances of any of the cases that died in the last reporting period. But what I can say is that the traumatic death of that person wasn't caused by COVID. The person died with COVID in tragic circumstances that were unrelated to COVID.
Numbers seem to be just a little bit further down today. Is that just because of perhaps slightly lower testing numbers, or are we seeing maybe that higher vaccination rates is helping?
Well, I'll wing it. We tend to see Sundays being a lower day throughout the course of this pandemic. But we are also confident that the increasing levels of vaccinations are starting to see not just hopefully a turning, a plateauing of figures, but compared to where we were in 2020, the hospitalisation rates are right down as a percentage term. And the levels of acuity of people who are getting COVID is right down to what it was in 2020. Now, COVID's not something you want to get. COVID is not something that you should go across, and you've got to think about the impact of this on our healthcare services, let alone you, if you should get it. But we hope that the figures are starting to plateau, that the level of acuity will continue to fall, and the most important way you can do that is to get tested as soon as you show any symptoms, because the sooner you get tested, the sooner you get treated, and the better your chance of avoiding hospitalisation. But even more fundamentally, as soon as you get vaccinated, your chances of avoiding catching COVID, passing it on, or ending up in hospital fall dramatically.
Just a really quick technical question. There seems to be a discrepancy between the Commonwealth and state vaccination figures. I think you guys told us yesterday we were at 91.2, we're at 91.4 today according to DHHS. The numbers we had out from the Commonwealth this morning, which are for yesterday, say we're only at 19.56. Do you know why that is?
Yeah, so the Australian Immunisation Register is a Commonwealth database, and it brings together all of its sources, both from GPs, community pharmacists and the state. We know from the data exchange process with the Commonwealth what those more up-to-date figures are. The AIR takes a little bit longer. It's about a day or so behind when it gets to its published figures. That's no criticism of the Commonwealth. It's the same right across the country, but we work on the same figures as the Commonwealth.
One more question, sorry. Restaurants and cafes in the region, some have been advertising that they won't increase their capacity limits this Friday so that they don't have to check vaccination passports and numbers and are advertising that. What would you say to that?
I'd say the rules apply to everyone, and that's the best way in which you can make sure that you continue to operate safely as part of your community is to follow the rules, and the vaccinated economy applies wherever you are in Victoria. Thanks everyone.
Thank you.
And thanks to Victorian Aboriginal Health Service.
Yeah, thank you.
Even if